And recordings in progress. We're going to get this started. If Kojiko wants and put it on there. I just looking at Julia, want to welcome Julia to the fold, and Terry's here. Terry told me last night that they'd be in attendance, so it's good to see them as well. And our we have one corporate member, Mike from RBC Dominion, is over on the far side. So at this time, I'm going to ask Lori Marshall to come up, and we're going to try to have the slides on the screen and Lori here being recorded on Zoom. Let's see how this goes. Good luck. And welcome, Lori. We're so glad to see you.
Thank you. You know, you've been away from Rotary when somebody says, we're so glad to see you. So I'm glad to be seen here today as well. And I'm hopeful. I'm going to go through a few slides specifically to the strategic plan. CKHA. But I would prefer, actually, if we just have ample time to ask me questions. There's nothing in these slides about COVID, so I'm sure that some of you might have questions about some of that. So with that, let me talk a little bit about where we're going as a hospital and what you see behind me. I love this particular graphic. It's our current and cultivating wellness together. And it really builds on our vision statement as an organization with respect to together growing a healthier community. And I think I've shared these statistics before. Unfortunately, Chatham Kent has higher levels of chronic disease and the rest of the and some relate to some of our habits. So we do tend to smoke more. Levels to grow for the world and consume among the lowest levels of fresh fruits and vegetables in the province. And concept of growing a healthier community comes from the cultivating wellness. If there's a way that can help to be healthier, yes. So this is really just an overview of the process that we used in the middle of the pandemic. So we weren't able to do the broad community consultation like we've done in the past. We're going to get that feedback. But what we was part of the Ontario Health team, and they did engage and gather that each sort of our component of that. Lots of internal engagement, working with our staff. And no, I said that you aren't going to hear specifically about COVID. As I said, what I was fundamental in how we think and reframe how we deliver care going forward. So this again speaks a little bit just to some of the information about our population that I've already spoken about, and just some of the things that have led focus in on some specific populations, and one of them that I would say that we have a major focus on in this particular strategic plan is our mental health and addictions population. And I think we would all acknowledge that is something that is hitting us significantly, both within Chatham Kent, but also across all of Canada and internationally as well. This pausing on. And I would be remiss if I did not speak about the significant impact of the pandemic on Chatham Kent Health Alliance. And our staff physicians and volunteers are in this graph as much as everybody else. So, what this essentially shows is that, we all lived through that first wave. There was a major impact of hospital admissions, those sorts of things that occurred in that way very quickly. There have been subsequent waves of COVID that each have had their own distinct flavor and nature depending on the variant that was there at the time. But what this really identifies is that there are subsequent waves to the pandemic. So one of the ones that probably most people go backlog. And one of the things that our chief financial officer, I asked him to put it into easy terms for us to be able to speak about. And what he did, just doing the calculations, is that for every month that we may hold back on our elective surgeries, it takes a year to actually recover that 1 month. So, that's really pretty significant when you think about that. And then that recovery assumes us going at 110%. So the same staff deployed out of the OR to work in the ICU during the COVID waves, now all of a sudden you're saying, oh, I'm coming on back to the OR. We sent you out of the area you normally work in. Next, what you are in order to help us catch up. So I think you can start to appreciate, and I think you're hearing about it in the press, about the level of burnout in healthcare. And maybe 3 years ago, I could say to a nurse, would you like to work some overtime? And they might say, yes. You know what? We're putting a new fence in and I really could use that extra money this week. We have essentially lost that ability for that discretionary additional effort right now. People are tired and they lived through the same thing that everybody did in the community. The personal fear, the worries about your own family, all of those things hit on all of our staff and physicians, as well as being at the front line and delivering that care. And so that's the one you sort of hear about first and foremost is the surgical backlog. But then you start to hear about all the chronic diseases. You may have seen today or yesterday some of the press about us with respect to, we're really seeing some unprecedented volumes right now and workload in the hospital. And this is normally a time of year we don't. This is normally a little bit of our reprieve through the summer as we get ready for flu season. And we're not actually sure what's going on, but there is a high level of demand. And part of it is that people who didn't seek care during the heights and the peaks of the pandemic, now all of a sudden, their chronic diseases are 2 years more chronic. Remember, chronic disease by nature of it gets worse over time. It's not something that is cured. An acute illness is something that you go in, you're able to cure. A chronic illness declines over time. And so now these people are showing up either at the doctor's office or the emergency department or being admitted because their chronic disease is just that much worse than had they been able to seek that care 2 years ago. So that's sort of that wave. And then that final wave is also, I would say, what many of us are seeing now in terms of the mental health needs of our population that's come as a result. People have gone through the losses that people have experienced, isolation, so those sorts of things. So these are all things that we need to be thinking about in healthcare, about how are we going to respond to those needs. So we've tried to be fairly simple in our descriptions of both our strategic directions and our enablers. So in terms of our strategic directions, it's really focusing on quality and safe care. And I would say that safe care really has come out loud and clear for us over the course of the last few years. We more spoke about the quality side of things, but since the pandemic, that safety piece is really embedded in everything that we do. and engaging with partners and patients and families and the Ontario Health Team. And, we're hopeful for the future. We don't know what will happen after Thursday's election, but I would anticipate, regardless of which party forms government, we can anticipate greater, more expectation of collaboration and integration across various and different providers. And then these are just, and again, I'm not going to go into these, but these are just some of the things that we're really focused on in terms of moving ahead with in where we want to provide care. I would say in the focus on mental health and addictions has accelerated for us with the building of the withdrawal management beds. We had thought that we would just, and so timing was everything. We responded to government when they pleased that we've been able to do that, and the renovations are ongoing. Need to acknowledge the municipal gift of I'm going to get my number wrong, of 500,000 exactly, that came from through public health and municipality. Certainly significant, also significant gift from the United Way that has come through there. So definitely a big thing for us as a community to be able to offer and provide that service. The patient experience is something that we really need to think through in a post-pandemic world. And so any of you who maybe access care from your primary care provider over the course of the last 2 years, chances are it might have been virtual nature. It might have been a phone call. It might have been an Ontario telemedicine, like a Zoom kind of call. And we're in this interesting place now where we went from sort of almost all face-to-face to almost all virtual. And now there's a question of where's the right place for that pendulum to land? And I think many of us would say, you know what, if it could be done by just a phone call, that's more convenient for me as a patient as well. I don't want to have to drive to London or wherever to access this care. And yet we would also say that certain times we want to see somebody, we want someone to see us and lay eyes and hands on us. So the concept of virtual care, I would say, is here to stay. And we've got to figure out as a sector, including the voice of the patient and family, about what's the right level of that. So that's some of the work to come. So those two directions were all about patients and families. The enablers are about what are things we need to have in place within the hospital itself in order for us to be successful. And on the left-hand side, we talk about the well-being of the entire team. We probably, in the past, I would say the nuance of the wording on these things would have talked about staff engagement, staff and physician engagement, staff and physician satisfaction. The focus of this plan is about how do we help everyone to feel well enough to come to work, to be able to work and practice and feel that they are well enough to do so. And that I would say is a major fundamental shift in healthcare. We're doing that work. And then on the right-hand side is the value for investment. I think we're now in our 6th year of balanced budgets at about 3 weeks in, and we stood here and made the commitment to the community that we're going to basically fix the financials. And so the financials are fixed. And I think we figured out now, not the secret sauce, but we know how to do that work. So that's why now we can sort of turn a little bit away. It's not that we're ignoring the financials, but we are able to now pivot a little bit and put our focus now a little bit more on that, the healthiness and the health and well-being of everybody who's at CKHA. So the question is, how will you know if you've made a difference? And so these are the success factors that we're saying that 3 years from now, or now we're well into our 1st year. So 2 years from now, we'll know we've made a difference. and we'll know that the actions we set out have made a difference. If we have fewer admissions to hospital, can we avoid the person coming in the first place? Can we reduce the number of emergency visits? Help support primary care in that perspective. Demonstrated and enhanced networks around mental health and addictions. One of the things that also happened early on in the strategic plan was the Chatham Kent ACT team, which is the assertive community treatment team. I used to have people say to me, why is there a building on St. Clair that has Hotel du Grace healthcare on it in Chatham? And it's because they were actually the sponsors of that particular program when mental health services were divested across the province. And it took a long time for us to work with them, work with the staff of that area to say, you know what, this is your home, this is Chatham Kent, let's bring you in with all of our other services in the Ontario Health Team. And so that was significant. So just as we talked about that financial piece changing over the course of the last 5 years, the other piece that's changed is the trust level among and between different healthcare providers. Increased patient satisfaction, patient safety, reduced physician vacancies, and I'll speak just a little bit to that, and patients really being able to move more quickly from the emergency department to a bed if that's required, and then always ensuring that balanced budget. One of the things you have heard a lot about is this health human resources crisis. Not enough nurses, not enough doctors, not enough anybody out there. And I would say that's true. And it has been longstanding. And what I would also say is if we put all of our efforts into recruitment and retention, we'll still be behind. So it's not that we can recruit and retain our way out of this crisis. And for me, it's a math problem. And you can either deal with the numerator or the denominator on it. So yes, we want to do, but at the end of the day, we all reduce the work. So that's where some of those initiatives about how do we avoid admissions in the first place. And nobody likes to be admitted to hospital. It's really not where you want to be. So if there's a way we can help you get home and stay home, then that's the best thing that we can do. If we can look at things like virtual monitoring in your home for individuals, all of these sorts of things that helps to reduce the work. So when I'm out and about within the hospital and talking to staff, and it's always really difficult for staff the CEO do. And what I say to them is my job is to try and reduce the amount of work for you. Your job is to make it as efficient as you can for the work that you actually have to do. And that's how I distinguish between our two roles. So now they'll hold me accountable for whether or not I've been able to reduce that, because I think that also there's been a shift in the health professions, and I think everybody recognizes that we won't be able to recruit the number of people that we need to continue to provide care the way we do currently. Patient exemplars, if you go on our website, you can see these are fictitious patients, although if you read them, you'll say, I know that person. It's probably because there are common experiences out there that people have. But these are our challenges to each of our program areas to say, if you do all of the things that are in our strategic plan, how would care be different 3 years from now for these individuals than the way it's being delivered now? So it always helps us to ground ourselves in patient stories that are based on real life experiences, but they've been amalgamated for that purpose. This is just some of the things that we've actually been able to do in the first year. And the commitments we've always made with our strategic plan is that it's a living, breathing document. So even though it's a 3-year plan, we like to, at the end of the, come out and say, here's what we'll do, where we've been challenged, and what else is also changing in the environment that we need to do some changes. I would say we're going to be strengthening over the course of this year is our commitment to equity, diversity, and inclusion. And I know we just heard from Rebecca recently here, and I would say that that is the case across many organizations. So I know that we're just in the process of hiring our executive lead to help us with this as an organization, and also recognizing that one person cannot do all of this work, and that we need to really reframe how we're thinking and where we go forward. So that's an example where the environment have changed slightly since we put it in our plan, but it wasn't as prominent. So we'll be moving forward with that. But we have done some good work and some good things over the course of the last year that we're quite proud of. I'll pause on that slide. What we can do is we can make sure you get a copy. If anybody wants to be able to see the detail, I recognize that a couple of those ones were quite dense in terms of the information that was in them, but please feel free to go on our website. And what we do is have the plan there, but we also update quarterly with respect to our goals and objectives and how we're doing. And we believe in that level of transparency in terms of where we go. And so I will end there and just ask if there are questions either about the plan or anything that's going on currently, or the pandemic. Yes, yeah. It's a great question. So just because of the recording, I'll repeat the question. Why is medical school so difficult to get into? So difficult to get into. There are only a certain number of spots. And we as taxpayers have to subsidize medical education tuition. Again, for those individuals, tuition is never a barrier to somebody doing medical school nowadays, I would say, in order to make sure that it's equitable access. But that it is highly competitive. What I will also say though is, and I think I'm right on this, when I talked to Dr. Furki, our chief of staff, he's indicated that in Ontario, and it's either currently or in the near future, 50% of our physicians will be international medical graduates. So, you know, it is I don't know that it's just a phenomenon in Ontario, but likely, you know, a number of graduates are going to come to us from other places. The one thing I do know is Western gives some degree of preference to Southwestern Ontario students if they've done all 4 years of high school in Southwestern Ontario, but it's, again, no guarantee and highly competitive. Yes.
Well, first of all, really, the pandemic of our community health system, of course, did an extraordinary job. I mean, we as a community team I was on the Alliance for first forum with the amalgamation. And of course, every organization is now in strategic planning. Much of what you said sounded later. I'm just curious how it will evolve 20 years or so since first of all,